Representative Oliverson, you were just talking a little bit ago about studies. You were citing studies that have been done, I believe, in Europe. Is that correct?
There have been studies that have on this issue. As I mentioned in one of my earlier conversations, this is obviously an area of emerging science. And so there have been many studies done around the world.
Okay. Are you aware of any of those countries where those studies were done? Did any of them actually ban this treatment?
I know that the studies that have done the systematic reviews that I talked about in my layout, that at least some of them have closed their gender reassignment clinics.
They've closed their
clinic.
But have any of them banned the treatment?
Well, as I said earlier, there are other treatments than puberty blockers and surgery. And so I think the treatment for gender dysphoria, I want to be clear, I believe gender dysphoria is a real psychiatric diagnosis that requires treatment.
Okay, but so the answer is that I think you're telling me you're not aware, perhaps, if any of them have.
I know that their clinics have closed.
Clinics have closed, but
Yes.
not necessarily banned the treatment.
And what I can also assert to you with absolute certainty, at least in the case of the National Health Service in England, is that the direction that we are going right now with gender-affirming care has been absolutely rejected by the United Kingdom, and they're going in a different direction. And they're emphasizing mental health, which is where I think, because this is a mental health condition, that is what we should be focused on, especially for children who have not completely matured from a neurological, emotional, mental standpoint.
Well, to that point, I mean, you are an anesthesiologist, and I assume that the American Society of Anesthesiologists is the organization that represents best practices and standards of care for anesthesiologists. Is that not correct?
So to be clear, the American Society of Anesthesiologists, like all other medical associations, is an organization that advocates on behalf of that profession, just like the American Nurses Association. It may promulgate practices and standards from time to time. It may offer continuing education. But I don't want you to get the impression that essentially whatever a professional society says is essentially written in stone. These things are. Hang on. I want to answer your question, but I really think this is important. And I think it's really important for everybody in the body, because there's so much talk about this session, to understand that all of these associations at the state and the national level are membership organizations that have annual meetings that a select number of members attend, and they discuss items in a House of Delegates, much like we are sitting here, and they adopt these policies, and these policies change. And I don't know if it would surprise you to learn, but it's been my experience, being a member of several of these organizations, that sometimes the policy that gets adopted is not always what the science says. There can be reasons why these organizations put out a statement or a policy other than what the literature says.
I appreciate that. I'd like to finish up asking a couple of questions here, a little bit more on this, because I appreciate what you're saying. But I would also suggest that these associations that represent particular branches of medical practice the membership in that are people who are involved in that practice. They actually have the expertise that we're talking about here, and you can question whether or not everybody is on the same page on everything, but the fact is that the society of any type of practice is representing that particular sphere of practice. They're not going to be out there representing something different. So the Pediatric Endocrine Society opposes bills that harm transgender youth. And so I want to ask you, if you question what they're saying, they say that bills such as this contradict, this is their words, evidence-based standards of care recommendations from the Pediatric Endocrine Society, as well as position statements, and they list a whole bunch of other medical associations as well. Are you suggesting that the Pediatric Endocrine Society, the group that you're saying are the experts in this, by saying that they oppose this legislation and that they support this kind of the treatment of care that we've been talking about here, that this bill is trying to ban, that they support that care it is recommended, actually, hormone therapy is recommended within this evidence-based approach, is what they say, and that they, as experts in the care of transgender youth, we strongly urge legislators to follow our medical advice and advocate for the well-being of all youth and oppose these bills. I could go on, but do you dispute that?
Representative, I would submit to you a couple of things. Number one, I would submit to you that I don't know much about the Pediatric Endocrine Society. I've never been to one of their meetings. But I would submit to you that these are membership organizations. I would submit to you that the American Medical Association, for example, represents less than a fourth of doctors practicing in Texas are even members of the American Medical Association. So when we throw these terms out and we want to act like these are authoritative, bodies and organizations, I think it's important to recognize that, number one, you have to pay, you don't automatically, just because you're an endocrinologist, belong to the society. You have to choose to join, which means that you have to have found value in the things that they're pursuing and the tenets that the policies, the things that they're doing.
The gentleman's time's expired.